Children in the child welfare system fare worse across multiple outcomes in both the short and long term than their peers who don't have this system involvement. It is really important that we intervene in order to disrupt this negative trajectory. And we know that in order to do this, we need to change how parents interact with their children and how parents respond to their children's challenging behaviors. There are interventions that have been shown to do this, specifically behavioral parent training programs. The premise of this approach is that it's by modifying parent behavior that we actually can prevent or disrupt child behavior problems. There are several effective interventions. However, there's limited evidence of their effectiveness within the child welfare system. They've been tested and used with clinical populations and other populations, but not particularly with the child welfare system, and we know there's a lot of complex issues going on within this system. So in order to bridge this gap, we actually conducted a randomized controlled trial of Pathways PPP to test its effectiveness with families within one Midwestern child welfare system. I do want to say that Pathways was developed by Matt Sanders at the University of Queensland and is part of a larger system of parent support and training programs. In our study, we recruited 144 parent-child dyads. Because most children remain in the home following a maltreatment investigation, we did opt to include only families in which the child remained intact, in which the family remained intact. Families were randomly assigned to either service as usual or to Pathways. Pathways was delivered in the home. It was a 14-week intervention that covered parenting principles such as parent-child interaction, parent attitudes and behaviors, as well as child behavior. The practitioner used a variety of techniques, including didactic teaching, video-based modeling, and parent practice or role play. While not all families completed every session, we did have a retention rate that was quite good, and 70% of our families completed 9 or more of the sessions. As part of this RCT, we measured those outcomes that were typical for this type of intervention, such as parenting behavior and attitudes, as well as child behavior. However, we also use this opportunity to measure and test a broader measure of child well-being or pediatric quality of life. And I'm now going to turn it over to my colleague, Paul Lanier, who will talk about the approach we took and what we learned.
Thanks, Trish. My name is Paul Lanier, and I'm currently an assistant professor at UNC Chapel Hill. But I was fortunate to work with Dr. Cole on the Pathways PPP study as a doctoral student at Washington University. When we were thinking about the measures to include in this study, we wanted to include a measure of overall child well-being, given that child well-being is an important goal of the child welfare system in addition to child safety and family permanency. We also wanted to test the hypothesis that improvements in parenting confer a benefit to child health. Based on our review of the measures, we selected the PEDS-QL 4.0, a measure of health-related quality of life, which is a similar construct to child well-being. This measure includes both a child report and a parent proxy report, so we can measure the perspective of both the parent and the child. The PEDS-QL has 23 items and measures 4 subdomains of health: physical functioning, emotional functioning, social functioning, and school functioning. The PEDS-QL 4.0 data was collected at baseline and at post-test following the 14-week PPP intervention. Both treatment arms for the clinical trial had equal scores on the PEDS-QL at baseline, about 70 out of a 100-point scale for the child report. We found that in the control group, the overall PEDS-QL score, whether reported by the parent or the child, stayed the same from baseline to follow-up. In the treatment group, the families who received triple P, there was about a 6-point increase in overall child-reported health-related quality of life and about a 5-point increase in parent-reported PedsQL scores. These differences were statistically significant in our regression models. Further, the improvements in well-being were clinically significant based on prior studies of the PedsQL. When we looked at the subdomains, the largest effects were in the emotional health domain when reported by kids and in the social domain when reported by the parents. These findings suggest that Pathways Triple P is an effective intervention for improving the well-being of maltreated children receiving child welfare services. Given the rigorous randomized design, we can feel more confident that the causal effects are due to the intervention. These findings complement other studies that have examined outcomes such as parenting behaviors and maltreatment recidivism by showing that improvements in parenting do impact a child's overall health. Back to you, Trish.
Thanks, Paul. Nationally, millions of children enter the child welfare system each year. As I've said, most of these children remain in the home. Therefore, it's essential that we have interventions for intact families that improve the health and well-being of these children. Our results are really promising. Maltreating parents are in fact capable of changing their parenting behaviors, and that these changes can improve the overall well-being of children. Another really important policy implication of this work is that there's been more and more of a focus of child well-being as an important policy outcome within the child welfare system. And our findings demonstrate that Pathways Triple P is in fact an evidence-based strategy to help the child welfare system meet this policy priority.